Hi, welcome back to Acupuncturist React, and on today's episode we're going to be looking at dry needling and what are the misconceptions out there. This just really annoys me, where do they think we're putting those needles into their chi? The points, those acupoints that we use are in muscles. The flow of chi, energy based, and the spiritual concepts that were understood in China 5,000 years ago. That's wrong. The spiritual concept, yes, there's philosophical concepts there, but they are scientific concepts, and it's not woo-woo and mysticism as they're putting it out here. What I've done is I've just Googled on my iPad, dry needling Melbourne. What is dry needling? This is Melbourne Spinal and Sports Medicine Clinic. Guys have got a lot of information about how it started and where it came from. Let's have a look. Okay, I think we're going to have something to say about this. Dry needling is performed at the MSSP to treat patients with headaches, jaw pain, neck and back pain, sports injuries, and to joints and muscles, to enhance pain management, incorporate with physiotherapy treatment to improve function. Needling of muscle trigger points was first developed in the 1800s. Wrong. It was developed way before that, dude. So sorry about that. But acupuncturists have been using needling muscle trigger points since the Han Dynasty. Progressed with formal research by Dr. Kellegren in 1930 and later by Dr. Lewis in 1940s. Dr. Janet Travell was president JFK's physician, further developed the treatment of trigger points. That's all true, and that is the progression of that particular therapy. But by saying they're the first people to ever needle a trigger point, or that was the first time, that's wrong. The concept of dry needling was initiated due to the philosophical concept of acupuncture in traditional Chinese medicine, TCM. TCM acupuncture was based on energy pathways and the flow of chi, energy based, and the spiritual concepts that were understood in China 5,000 years ago. That's wrong. The spiritual concepts, there's philosophical concepts there, but they are scientific concepts, and it's not woo-woo and mysticism as they're putting it out here. It makes it sound like Chinese medicine's hocus pocus, and dry needling's scientific and using the muscles. Whereas, I don't know, TCM practitioners use acupoints, and then it's got in the little quotes, chi energy flow via meridians to treat patients. This just really annoys me. Where do they think we're putting those needles into their chi? The points, those acupoints that we use are in muscles. So it's just a different way of looking at things. It's a different way of understanding how the body works. So by sticking a needle in and getting a twitch response from a trigger point, so let's say if you would just purely think about it from a Chinese medicine perspective, a patient would say, I've got pain here. You'll palpate that area. You would find the trigger point, which is like a tightness in the muscle. The Chinese would, in Chinese medicine system, they call it an sure point. So it's like a tight, painful kind of spot. You feel like almost the fibrous muscle tissue sort of, The thing is that, there was a period of time in acupuncture where these concepts were kind of propagated and then misunderstood. And it also comes back to just popularism. It's been popular at times for things to be spiritual. It's been popular at times for things to be mystical. And it's also, part of it's just a lack of understanding, which maybe you could even think of it as a kind of a racism. Just because you don't understand those concepts and what they mean, it takes a really great mind to understand what were the Chinese trying to say back in the Han Dynasty when they were writing about acupuncture in the older textbooks. What were those things meaning? That takes a really great scholarly mind to be able to understand that and teach that. And unfortunately, there's not many of those people around. And so what has been taught in acupuncture schools sometimes has been that concept. Or maybe students or there's been times where people, they have an affinity to that. And, at acupuncturists, we're guilty of marketing things the way we want to market them as well. And so there's no spiritual belief that's needed for acupuncture to work, and there's not a mystical force that you're needling into. There's a lot about the human body that we don't understand. Even with all the technology and the things that we have, we cannot necessarily quantify everything that happens in a human body with our scientific understanding. There's things that the Chinese have explained about how the body works, and particularly the interconnectedness of the body, which when you learn it as an acupuncture student, it does seem mystical. It does seem a little bit like it's a concept. It's a metaphorical concept. There's a lot of things that are metaphorical concepts. And so, you know, you kind of understand this, and it's not until you see it actually working in clinical practice where you see, you know, the way diseases play out. But yeah, don't get me wrong. The theory that Chinese medicine is based on is incredibly scientific, and it's not mystical. So they're basically saying that, you know, back at that time, which I would just say is due to ignorance, that just that lack of understanding, how it was propagated, and that's a misfortune on our part. But I'm making this video. This is my little way of trying to rectify some of that and put the right knowledge in people's heads that you know, that it's not like one or the other. It's not like if you have acupuncture, you're accessing some sort of, you have to access chi and meridians, and this energy flow business. What that is a whole nother concept, and we don't have time to get into that like right at this moment. But yeah, let's keep going with this website. So dry needling can be performed following the pathway of the nervous system. Good on them that they've actually got some research there. Like they've actually got some people that they're quoting there, rather than just saying research says and not having that. So that's a good thing. For example, the pathway of the sciatic nerve and its branches can be followed for those with sciatic or back pain. The brachial plexus and the branches of those with neck or arm pain can be, and the intercostal nerves for those with intercostal pain. Similarly, dry needling can be applied. So what's really interesting is, yeah, okay, they are saying they are only using that. But the way that, so Chinese medicine practitioners in acupuncture school, they learn all of this stuff. They learn not in as much detail as a physiotherapist uses, because that's not their modality. Like let physiotherapists do what they're great at doing. And you know, I'm not trying to say acupuncturists can do what a physio does, but we are taught, we do teach students about nerve pathways. They learn about, like, so you can almost see it like that overlay of different aspects of the body. And so then once you understand all those things, so you understand the body from a Western anatomical perspective, and then, you know, it's like a biochemical perspective, and then understanding it from the Chinese medicine perspective, you can actually see the interplay of those things together. And you think, wow, that's so, like, what I think is like, wow, that's so clever that the Chinese were thinking of that before they did understand nerve pathways and things. Like it's a misconception to think that the Chinese didn't, they did do surgery, they did open up people's bodies, but they just tried to find other ways and propagated other ways of treating things, rather than you know, as far as the West went in terms of like dissecting and cutting things down to the, you know, the smaller details. Again, getting off on a tangent. So I just want to let you know that I am a real acupuncturist. I'm a registered acupuncturist in Australia, but the purpose of this series is to put people on the right path about what Chinese medicine and acupuncture really is. It's not to defame or, you know, I'm not doing this to belittle other professions. It's just this one issue that gets my goat up. And so, yeah, it's not to have a personal attack at people in any way. That's not the purpose of this. It's just to, you know, to give Chinese medicine a fighting chance and show people what it can do. Show people what it really is, rather than it being eroded by these misconceptions that are out there. Hi, thanks very much for watching Real Acupuncturist Reacts. I hope you've learned something and hope you had a little bit of fun along the way. Please join me for my next video by subscribing to my channel, and if you want to, you can leave a comment in the comments below. Thanks, have a great day.